for the sake of time, we can hurtle headlong into our next presentation, which has been given by Joanne Jessup, our clinical nurse specialist. And the presentation is navigating the transition between paediatric and adult care. And the catalyst for this presentation was the wonderful Wolverhampton Transition Day, which was held in the unlikely surroundings of Chelsea Football Club. It was organised by the Brompton Inherited Cardiac Condition Nursing Team, and it's the first in an annual series where Brompton heart patients aged between 14 and 19 and their parents are treated to a day-long conference that helps to introduce teenagers into the adult world of taking responsibility for their health and lifestyle. And that's what transition means. As Joanne's going to say, it means facilitating the smooth passage from child to adult care by empowering teenagers and enabling them to make informed decisions about the treatment and monitoring they need for their health condition. And it's over to Joanne.
Thanks, Victoria. I'm going to be talking about transition, and as Victoria mentioned, the Marfan Trust recently attended the Royal Brompton's Transition Day. This was organised by the Inherited Cardiac Conditions Department. So this was a really useful day for teenagers with all sorts of different conditions to get together, learn a bit more about their condition and start taking a little bit more responsibility so that eventually they can become independent in making decisions about their care and also navigating our health system. So as Victoria mentioned, the RCN defined transition as the purposeful, planned movement of young adults with chronic conditions from child-centred to adult-oriented healthcare systems. Now, obviously, as all of you know, Marfan syndrome is a chronic condition that's going to affect you lifelong. So it's important to move through that paediatric to adult care so that you're getting all the attention that you need. So depending on when you're diagnosed, obviously people do get diagnosed at different points in time, but obviously if you're diagnosed as a child, you will be looked after primarily in the paediatric department. That may be in a paediatric hospital like Great Ormond Street, in which case you may need to be transferred completely to a different hospital, or you may be looked after, for example, like the Brompton, they have a paediatric department and you will move into the adult service there. So there are different models, but it's basically moving you from the childhood care to the adult care. The plan is to start that process around the age of 12 to 13. So when your child or young person is sort of getting into year 9, we should start thinking about them starting to take a little bit more responsibility, learning a bit more, and starting to have those conversations about how to manage your condition. And that would be with a plan to start moving to adult care between the age of around 16 to 18. Again, lots of different hospitals have different ages at which children move into the adult sector, but usually by the age of 18, you will be looked after in the adult setting. So why is this so important? As I mentioned, Marfan syndrome is a chronic condition. You're going to need care throughout your life. And children and young people need to learn about their condition at an age-appropriate level. Now, I'm sure lots of you with children with Marfan syndrome, or as children, gradually learned about your condition, how it affected you, and what you needed to thrive. And that just needs to be a conversation that starts very young and becomes a little bit more formal as they reach those teenage years. We all know that adolescence is a time when young people start to push back against authority. They may try and make their own decisions. They want to become more independent. Now, that's good. We want them to become independent, but we also need them to do that safely. And obviously, when you have a chronic condition, we need to make sure that they remain within follow-up. And this is a risk point of children sometimes disengaging with healthcare. And it's really important that we try and engage them at this point so that we don't lose them to follow-up as they grow up, because they really do need that follow-up and surveillance throughout their lives to make sure that they're getting all the care that they need. And then obviously they need to start taking responsibility for their own health. So most hospitals will have some form of programme in place. They do differ, but the aim is to make sure that the care that the young person is receiving is planned with adult services and that those children have met the multidisciplinary team who will provide the care in the future. We don't want to just pass them off into a black hole. They don't know who they're going to be seeing. They don't know where they're going to be seen. We want to make it as smooth as possible, to make it as easy as possible for them to engage with the adult carers. We also need to empower the young people with the information that they need and the education they need to make informed decisions about their care and about their lifestyle and about their ongoing health. We may not always agree with their decisions, but if they have the information that they need about their condition and how it affects them, then those young people can start to make decisions for themselves. And we also need them to understand not just their condition, but the healthcare system. The NHS can be complex, and they need to understand the system so that they can advocate for themselves and have access to the care and follow-up that they will need throughout their lives, and just to know what's out there and available for them. So this is just a brief slide to let you know that this is written into guidelines. So there are nice guidelines about transition. So this is something you should be expecting for your children. They should be having some form of program. They have a chronic condition. So this is something you can ask about, find out what they will be offered when they're seeing their paediatric doctors and are moving to that point when they need to think about transferring. And the Americans also, in their guidelines about supervision for children and adolescents with Marfan syndrome, they also highlight the importance of coordinated care with a special focus on that period of transition from adolescence to adulthood, because I think everyone recognises it's a difficult point in life without a chronic condition. So we really need to give these young people the extra support that they need. This is just a slide to highlight how complex it can be. So obviously I mentioned the Brompton talk, the Brompton Day earlier. That was arranged by the Inherited Cardiac Conditions Department. Now, they have an excellent programme, and lots of cardiac departments will have an excellent programme. So if your child has cardiac involvement, the chances are that will be really well looked after and they will get the care and support they need. But as we know, there are lots of other effects of Marfan syndrome, and your child may have numerous other specialities that they're seeing. And they need to ensure that all aspects of their care are transferred. Now, the problem is, obviously, who will take ownership? And unfortunately, that often falls to the parents, the families, to take ownership, to try and help coordinate that. You may find an amazing nurse specialist within the multidisciplinary team looking after your young person who can help facilitate that. But I think it's worth remembering that it's helpful if you can ask those questions as your child gets to that sort of age, 12, 13, 14. Start asking those questions when you go to clinics with them. What are the plans for adult care? Where will they be seen? What ongoing follow-up do they need? And what do they need to know about their condition? So unfortunately, at the moment, with a condition such as Marfan syndrome, where it can affect everyone so individually, I think it's really important that families try and build that kind of personalised transition programme with the support of the multidisciplinary team around them. So what can you do to help your young person with the process? I think one of the most important things is start early. So from a very young age, if your child's been diagnosed with a condition, talk about their condition, answer their questions, obviously in an age-appropriate way, and those answers will change as they get older. Don't ever assume that a young person knows something already. I think if you are a parent of a child with Marfan syndrome, you may be an expert in the condition. You may have learnt from the age of, 10 years that all about their condition and know the ins and outs of all their follow-up. But your young person, your child, may just come along to the appointments, follow you into the office, let you talk to the doctor and go home again. And they may just do what they're told. So never assume that they know what you know. Check with that and make sure that the hospital are doing that. I always make sure that I ask patients about what they understand. Can they describe things to me? Because it gives you a little bit more information about their level of understanding and where you're working from. I'm going to show you a tool called Ready, Steady, Go in a second, which some hospitals are using, and it's a really good framework that can guide the process. So that might be something that you would find useful. I think something that parents can sometimes be reluctant to do is let that young person have a bit of time with the doctor on their own if they want to, with the doctor or the specialist nurses. It gives your child a bit more confidence. Even if you just start, rather than leaving them on their own, maybe just start by saying, right, you answer the questions this time. I won't answer for you. I'm going to sit here with you and I can help you, but I want you to interact with the doctor. I want you to answer their questions. I think that's really helpful just to build their confidence in and develop those relationships with the healthcare professionals that they're going to need. And always ask open-ended questions. So rather than just asking a teenager, do you know what Marfan syndrome is? You know you're going to get an ugh or a strange noise, no answer really of any detail. If you ask them, can you explain to me how Marfan syndrome affects you? That's going to open a conversation. It's going to let you talk about their understanding and let you move on and discuss that further. Try and involve them in the clinic processes. Let's write a list of questions you want to ask the doctor at your next appointment. You may have your own agenda, you may have information you want to know, but there may be very different questions that are really important to your child that you hadn't even thought of. So I think it's worth starting to involve them and ask them what they want to know, what they want to get out of their appointments. So this is the Ready, Steady, Go programme that I was talking about. It's a really great website. Your young person can look at it, you can look at it, and as I said, some of the hospitals are using this as a framework to help guide their transition programme. So it's a website that you can visit, and I've just picked out one of the pages. So it's a little bit busy, but it just gives you an idea. So the idea is that you move from red to amber to green, and at the green point, you're ready and you have most of the information and the framework that you need to move forward and be able to independently manage your healthcare. Now, obviously, adults still need support. So it's not that they're going to have to just take it on all by themselves. We all live within families and networks. We're going to need support lifelong, but this just is a framework where you can make sure that young person has some of the information that they need. And it breaks it down into bite-sized pieces that can just be even a conversation starter for you. So even if your hospital isn't using this program, you may find it something useful just to have a look at and start conversations with them. This is just one other thing I thought was useful to mention, which is linked to the Ready, Steady, Go programme. It's the Ask 3 Questions initiative. And I think it's a good way for young people and for adults just to start thinking about how they interact when they have their appointments, and just 3 really useful questions that you can ask when you're with your doctors. Because some of the research that AQUA have done has suggested that these sorts of questions prompt clinicians to give really good, understandable information about the options for care, the potential pros and cons, and how they would affect you. So I think it's a really good idea. What are my choices? What's good and bad about each of those choices? And who can I ask for support? They're really good basis to start that conversation. And I would just say, when you go to the appointments, make sure your young person writes down questions. It's going to be a very unfamiliar environment when they first start going. They're going to have hundreds of questions, from what job can I do? Can I have a baby? Complete range. What exercise can I do? Can I be a footballer? Make sure they write all their questions down, because they're really important to them. But also write down your answers as well, because you can often be overwhelmed with the amount of information you get from the doctors or the nurses. And so don't feel bad about jotting things down, so that you can have a think about it after the appointment, and then you can ask more questions of your GP or nurse specialists when you speak to them again. And just to mention, we're here as well as the Marfan Trust. We are here to help. We have a helpline. We can arrange peer support for young adults. We've also set up peer support for children. So we match people with similarly aged children, obviously with parental supervision, so they can chat. It can be a lonely, if you're perhaps a spontaneous Marfan syndrome child, you might not know anyone else in your network with such a condition. So it's really helpful maybe to build those relationships with someone going through something similar to you. So that's a service we can provide. We obviously have some of the patient information leaflets two of them here that are quite relevant to young people I've just shown. We have a great advisory committee, so we're always able to answer questions or queries that you or your young adult might have, and we can access our wealth of knowledge with specialists on the advisory committee. And we're here to advocate for you as well, from helping decipher a really difficult medical letter to helping you with PIP support or support with college applications. Anything that you might need, please do contact us. Thanks very much for listening, and if you've got any questions, I'm very happy to answer them.
Thank you, Joanne.